Hello, everybody. I'm back. Dr. K.K. Agarwal, President, Confederation of Medical Association of Asia and Oceania, past National President of Indian Medical Association, and President Heart Care Foundation of India. And you are watching Med Talks with Dr. K.K. Agarwal non-stop, 165th edition on COVID. Let's have the headlines of the day. So India recorded around 22,000 fresh COVID-19 infections and 300 fatalities from COVID-19 on Wednesday. MedTalks crosses 2 million viewers ever since we started this program. The drug regulator subject expert committee on COVID-19 likely to meet tomorrow to take final call on approval of vaccine in India. 10 more returnees from Britain test positive for the mutant variant found in the UK, taking the tally to 25 cases in the country. The Central Board of Indirect Taxes and Customs allows import and export of coronavirus vaccines through courier. UK authorizes emergency use of Oxford AstraZeneca vaccine, raising hopes for Indian rollout. Before we go to the topic of the day, let's do our ritual with our partner, Dr. Rajesh, the hygienic partner, and we take the ultra protected gel and we say S for Seedha, U for Ulta, M for Mutti, A for Angutha, N for Nakhun, and K for Kalai. And we are ready now for the topic of the day. The topic of the day is Brazil experience and expectations in 2022. And for this, I have a special guest, Dr. Deborah Nobrega Covelcanti. She is the Director of Parliamentary Affairs of the Brazilian Medical Association. She is the Counselor of the Paraíba Regional Council of Medicine. She is the member of the Commission for Medical and Social Affairs of the World Medical Association. She is the professor at the Faculty of Medicine Nova Esperneca Joa Pessoa Paraíba. She is also the assistant to the mastology service of the hospital Santa Isabel João Pessoa, Paraíba. So welcome, Dr. Deborah, to be here with us. I understand, I always remember an Indian movie where the hero and the heroine did not understand their language properly. And one of the best movie in the India was an interaction between two people when they have a language problem. I understand that both of us may have difficulty in understanding each other's accent, but we will be slow and make sure that we come out with clear messages for the people who are watching. So welcome to India, virtually India. You are now in India virtually. Would like to have your presentation on COVID situation in Brazil and what are the lessons learned by you so far? Can I have you to speak?
Good evening for all in India and good morning for all here in Brazil. On behalf of the Brazilian Medical Association, I appreciate the invitation to participate in this event, and I would like to say that we admire your work very much, Dr. K.K. Agarwal. So I will try to say to you generally how is our experience here in Brazil and the expectations in 2021. The next, please. I declare that I have no conflict of interest. So first, I want to say to you that Brazil is the 50th largest country in the world. The population is more than 2,000 million, 200 million, and we have 26 states and one federal district. We have more than 5 municipalities, and the health is municipalized. So I tell you these things to say how difficult it is to do only one method to in this war of the COVID-19. It's very difficult because we are a largest country like India too. The next one, please. So our public health system is unified. It's a unified health system. Is one of the largest and most complex public health systems in the world, ranging from simple care for blood pressure assessment through primary care to organ transplantation, ensuring comprehensive, universal access and free for entire population of the country, and sometimes to the visits. I had the opportunity to assist some people from another countries here without paying nothing. So it's difficult to maintain this kind of system. We need the population comprehension of the people and all the doctors and other people that works in health system, because it's very, very difficult to manage it. The next one. So the municipalities have autonomy in health management, but receive funds from the federal government to carry out the health programs. So in case, specifically in pandemic of COVID-19, many municipalities, the mayors of the cities, they decided to treat in different ways. The next one, please. We have the first case in February and the first death in March. The panicked population, we had lockdown. Some people get very stressed with psychological problems, like you treated very, very well with Dr. Miguel Jorge, our friend from the Medical World Association, our last president said. So it was very good to tell to the people to stay in lockdown. But the next one, the government and the other people and did many enlightenment campaigns to explain the population how it was important to wash the hands, to use alcohol gel like you used in the end of our talk, and the wear of masks correctly. And we had big campaigns. People are sufficiently enlightenment, like how to treat this situation. But it's very difficult because many of them don't want to accept that we are in a terrible pandemic now. The next one, please. So, the Ministry of Health published manuals, guides, and guidelines about the treatment and the diagnosis and treatment of COVID-19, improve the centers of therapy intensive. The medical societies disagree in most of these guidelines and published another guidelines, and medical entities decided that doctors are free to treat the patients with their free and informed consent. It was the way to stop the war between the medical societies and the Ministry of Health. If you see it's necessary, you can stop me, Dr. KK.
No, carry on.
The next one, please. The Brazilian Medical Association, how is our business? We create a crisis group, and every day this group have a meeting to discuss the problem. We open a channel for complaints about the lack of personal protective equipment, and we have a lot, almost 3 million doctors saying that they don't have protective equipment. So we decided to donation of personal protective equipment for the health professional, not only for the doctors, but all health professionals. We have support, psychology support for doctors, and we had a lot of webinar with scientists. The next. Then here is an example. One of our directors, Dr. Hobson, with the health professional donating equipments, and the other image is from a meeting with Brazil, Paraguay, Argentina, and the Uruguay to talk about the problems in the cities are nearest. Brazil, Argentina, Paraguay, and Uruguay. The next one. So we had, if pandemic ended, people education was enough to the case increase, we had major elections. So people stayed crowding every time. It was very difficult to say them stop crowding, lack of care, and now we are in summer holidays. So the cases are increasing a lot. I think we are in a second wave of the COVID cases. The next one, please. Here we have a slide showing the evolution since the beginning until 29th of December. And we have an increasing of cases. The next one, please. And here, this graphic is from the death, about the death. Now we have almost 200 million deaths in Brazil. Next one, please. And our expectations. Here, 4 vaccines are being tested. CoronaVac from Sinovac Research and Development and Butantan Institute, the Oxford vaccine, These both will be produced in Brazil, are being tested too by BioNTech and Janssen vaccines. And in these days, this week, the Ministry of Health presented the vaccination plan for the people. They said that it will be start in the end of January or is beginning of February. I hope so. The next one. I want to say once more how important for me and for our Medical Brazilian Association to be here. It's a pleasure. And we say to you a good, an excellent, not a good, an excellent with God bless 28 and 21. Here is all the members of our directory. Thank you very much.
Thank you, Deborah, for your wonderful talk and presentation about Brazil. One thing which touched was that every citizen from diarrhea to transplant is given free treatment. Not easy for any country to provide free treatment for everybody. Now, what I will do is I will try to take the, I will try to, if I see, not this one,
And
I will
I
try to
want to
pick
say
up
too,
the share screen. Mm, not this one. So I want to, if you see this daily new cases in Brazil. So Brazil started its first wave in April, and the first wave started declining in August, and then it restarted its cases in November. The second wave has come somewhere in November. Do you have any particular strain in Brazil which has mutated? Do we have any data to say that Brazil second wave is also because of a mutation? Can you answer that?
sorry, I didn't listen.
No. What, see, what I'm saying is there is a second wave in Brazil. The second wave in Brazil, is it due to any mutation or not? Do we have any data to say that in Brazil the virus has gone into a mutation? Have you, is it clear? I'm asking about the new strain.
The news.
Is there an mutation in Brazil?
Sorry, Dr. KK. My internet, I think it's not very well. I can't understand can't listen all the question. You asked me if I think we are in the second line, second wave. Ah,
So is there
I
any,
sorry. I don't have date to say it. I don't have yet any date. But I think there is. I'm not specialist in, but I think it maybe because our country was open to all the visitors since last week. Yes, the
welcome.
vaccine will be free for all, and the Ministry of Health will they presented a plan to vaccine all the people, starting with the health professional, doctors, and elder people, and people that are chronic disease. They will take the vaccine first. I don't know what the vaccine I will take. I will ask the doctors that started it, because I don't know. I think that here in Brazil we have two vaccines that will be take to the people. A Chinese vaccine and the Oxford vaccine. I don't know. I don't have mandates about the reactions of the vaccines. They didn't show us yet the end of the tests. They said that it will be published in these days. The schools are closed, most of them. Some schools asked to the judge to open, but generally they are closed, almost closed. I'm a professor in a medicine school, and we had some classes by platforms of internet, but the practice classes are very difficult. We can't do them.
Do you have home isolation policy?
No, no. We have yes. We have a big country, as I said before, and it's very difficult to say to people stay home. But it's difficult to say stay home because they need money. So we have to say them be careful. Take care with your health and with your family, but it's difficult now to say to the people stay home. They will be not stay home. Here today we had Réveillon part are closed all the beaches to do this. All in Brazil, in Rio de Janeiro, and Copacabana, every year is a big part, but it stopped because of the pandemic. Uh, People wear masks in almost all the people wear masks, but they were wrong. They most of many times they put the mask on the neck, in the ear, without put on the nose, covering mouth and nose correctly. They use more than one time, but I think it's not so bad that it was in the beginning of the pandemic. They are wearing, generally, I can say that people here are wearing masks and are taking care with their health.
So that's all for today. Let me explain to the people who are also watching in local language also. So Deborah, I'm going to speak in Indian language to some of my viewers who are watching this program. So डॉक्टर डेबोरा ब्राज़ील से हैं और इन्होंने बताया कि ब्राज़ील में भी लॉकडाउन हुआ। ब्राज़ील के अंदर में भी 5वीं वर्ल्ड की सबसे बड़ी पॉपुलेशन है। ब्राज़ील में भी सेकंड वेव है, म्यूटेशन है कि नहीं है वी डोंट नो। ब्राज़ील में भी स्कूल बंद हुए। ब्राज़ील के अंदर में 100% लोगों को वैक्सीन फ्री मिलेगा, उनको सारे ट्रीटमेंट फ्री मिलते हैं इसके साथ में। सो ब्राजील के अंदर में 5 वैक्सीन का ट्रायल चल रहा है, और उसके अंदर में चाइना के वैक्सीन का भी ट्रायल है, फाइजर के वैक्सीन का भी ट्रायल है, ऑक्सफोर्ड के वैक्सीन का भी ट्रायल है। और ब्राजील के अंदर में सबसे इम्पॉर्टेंट चीज ये है कि पूरी कंट्री मिलके सबका इलाज फ्री करती है। बट द मोस्ट इम्पॉर्टेंट थिंग व्हाट शी हैज सेड इज that government will come out with their guidelines. Medical association is free to build their guidelines, but every doctor has professional autonomy to sign and take a shared decision with his or her patient. So when it comes to a shared decision between patient and doctor, so there are things the government may suggest, the association may suggest, but it is between the doctor and the patient to decide what they want to do. And that's what one of the best policy I've seen it is in Brazil. So thank you very much, Deborah, to be here and giving a wonderful insight about your country. We are calling one by one all the nations and trying to interact with other people. In India, we are we have a very low mortality. One of the reason is early diagnosis, and we are treating inflammation and thrombosis much earlier. Therefore, we have been able to check the mortality. India is likely to have its first Oxford vaccine approved tomorrow. And then we also have a Covaxin killed vaccine like a China one, which is also likely to be approved. Russian vaccine is also undergoing trial in India. India is also doing a trial on a messenger RNA vaccine like Pfizer, which will be indigenously made. So in India, we are also moving towards herd immunity. The seroprevalence rate in India is between 30 to 50%. That means 30 to 50% of the population already has suffered from asymptomatic virus condition. India has 25 cases returning from UK who have developed the new infection. But we feel that India has already, if 50% of the population has already got infected, the herd immunity will come very, very, very soon. So that's only one wanted to say what is the position in India. So thank you very much for coming here, and Happy New Year, and grateful to have come on 31st December, which is most of the people will say I'm enjoying, let me have a party. So thank you very much for coming here. And glimpses of this video, we will show it to our colleagues in Simao. And we will also include it in our daily correspondence that you had visited our country. I would say you have visited our country. So thank you for that. If you want to say anything, you can say.
Yes, I want to say that about 400 doctors died with COVID here in Brazil. In my state, uh, 22 doctors dead. So I hope that people take care with their health, because here the doctors are very stressed and tired to work a lot to treat this disease. So I hope all you have a happy and health 20 and 21. And to say again that it was a big pleasure for me stay here. And I apologize that I don't speak well, and I'm not a scientist in the area.
You spoke beautifully and you spoke very well English. And I dedicate this program to all the 400 people, doctors who have died in Brazil, and over 700 doctors who have died in India. So I dedicate this program to them, and I wish everybody a happy new year and a new year which is out of without any fear of corona. Thank you. Thank you. So that's all for today. We'll be back tomorrow, 7 p.m. with another show. Keep watching Med Talks with Dr. KK Agarwal. Namaskar. Stay tuned.